Hi, my name is Hunter, and today I will be performing the skill of inserting an NG tube. I'm in school appropriate scrubs, and I have my badge here, and my patient. So, the first thing we want to do is we want to gather our supplies. So we've got our gloves, we've got our emesis basin, we've got petroleum jelly, we have our syringe for aspirating gastric contents. I'm using this cup with this to do my example of pH testing. We have our basin with our NG tube, and then we have water with ice for the patient, and then we've got our hand sanitizer as well. So first things first is we would go into, make sure I have this, we would gather our supplies, enter the patient's room, knock on the door, and introduce ourselves to the patient. While doing this, we would want to go ahead and perform our hand hygiene. Hi, Mrs. Smith. My name is Hunter. I will be your nurse today. Can you go ahead and verify your first name and your date of birth, and while verifying it with our armband. Okay, great. So first things first, we always want to make sure that we are verifying the provider's orders. Ideally, I should have done this before I entered the patient's room. But yeah, so we want to first start by explaining the procedure to the patient. All right, Mrs. Smith, I'm going to be inserting there's been an order put in to insert an NG tube for you. That's going to help with some feeding just due to some of the health conditions that you have going on. It'll make things a little bit easier for you, and that way you can get nutrients that you need. So we're going to go ahead and first start by raising the head of the bed, bringing the patient into a high Fowler's position. Obviously, as we do this procedure, we want to make sure that we ensure patient privacy and comfortability in doing this. So raising the head of the bed to high Fowler's if there's no contraindications. So as we do this, bring them up, and then we'll go ahead and put on our gloves to go ahead and start with our procedure here. Okay. So Mrs. Smith, as I insert this, we're going to be inserting the tube in through your nostril and down the back of your throat into your stomach, okay? I know it sounds a little bit scary, but we will make sure that we take really good care of you, okay? So first, before we go ahead and insert, we want to make sure that we check the patient's nurse and figure out which one is going to be best suited for the patient. While we do this, so we would have them hyperextend their neck and we would look in their nostrils. Okay, so after assessment, the nostrils are patent. There's no inflammation. There's no ulcer, no sores, or any contraindications. So next, what we want to do is we want to see which nostril has the most airflow. So we would have the patient okay. So we would plug one side of the nose and have the patient breathe out. So we could then determine which nostril has the most flow. Sorry. Okay, so it looks like the right nostril has the most flow, so we're going to go ahead and use that side. Pen light. Okay. Alright, so before we insert the NG tube, we want to make sure that we measure it appropriately. And so in doing that, when we are measuring placement, we are going to start at the tip of the nose to the earlobe and down to the xiphoid process. Okay, so about 50. Yeah, okay. Alright, Mrs. Smith, so as we do this, what I'm going to have you do is I'm going to have you put your head back slightly as we do this, and then we're going to insert slowly, 5 to 10 centimeters at a time, as you swallow. And in doing this, we will have you lean forward just to kind of help alleviate some of that gagging reflex, and then we will also have you take some sips of water as needed. So as we do this, please let me know if you feel nauseated or uncomfortable. Just go ahead and raise your hand, okay? Okay. So first of all, we want to lubricate, add some lubrication. We would have this in a little container, but I don't have, I mean, I guess I could. Okay, I'm going to use one of these. I guess I could just... Okay. And while we're prepping the patient, we can always, we would be setting this in the warm basin as well. So, okay. All right, Mrs. Smith, are you ready? Okay, so we're going to go ahead and insert down. We're going to go along the naso cavity. Yep, okay. Insert. Okay. Okay. All right, we've hit the oropharynx, so now we're going to have them lean forward because at this point they're going to start to gag a little bit, so we would have the patient lean forward. Okay. If needed, have them take a drink of water. Okay, right. Now each time that I continue to push 5 to 10 centimeters, I'm going to ask the patient to swallow. So go ahead and swallow. Okay. Swallow. Good. Swallow. Good. Swallow. Good. Oh my goodness. Swallow. Good. Okay. So we've hit the 50. All right. Are you doing okay? Yes. Okay. So then from here, we would go ahead and secure the tube. Okay. My gloves are way too big. Okay. We might use some skin adhesive to help hold that in place if needed, but for right now we're just going to do tape. My tape is not wanting to stick. Okay. Okay. Right, and then from there, I'm going to clip this to the patient's shirt. I don't have a safety pin or anything, so I'm just gonna tape it. Okay. But ideally we would want to put that in the patient's shirt. Okay, now from here what we're going to do is we're going to test the gastric contents and get test the pH, and then also make sure that we are verifying placement with an x-ray. So what we'll do is we're going to go here. Okay. Okay. Right. And then we're going to twirl it around a little bit, and then we're going to put it in our cup for pH testing. We're going to put the pH test in. Okay, and depending on the facility, pH is 1 to 5. Okay, so it's within range, so we are good there. And then we would have the x-ray team come in and do a verification on placement. And then we want to sit the patient back up, patient's already in high Fowler's. We would then want to make sure the patient is comfortable, in a comfortable position, and make sure that there wasn't any concerns with the patient. Now, what we want to do is we want to also just assess and document anything that might be coming from the tubing as far as like drainage goes or anything like that. But then we would also want to make sure that everything is patent. There's nothing that is going to cause issues with feeding or with the feeding apparatus or the suction system. So we would definitely want to make sure that we're clamping the end of the tubing, things like that. So with that, we are done. Now, again, we would want to make sure that the patient is comfortable, whether we put them back in a reclined position and or laying flat, just depending on, the comfortability of what the patient needed. So after that, what we would do is we would go ahead and, clean the patient up. You know what I just realized? I don't have a towel to cover up my patient. So ideally, in this procedure, we would want to make sure that we are, putting a towel across the patient to prevent any kind of mess from happening and or just to keep them dry. So if suctioning was applied, we would definitely want to maintain patency. Now, with that, and wrapping this up, we would definitely want to clean this stuff up. Okay, and then we would want to go ahead and remove our gloves, ask the patient if they were doing okay, and then after the procedure, we would definitely want to document the procedure, how it was tolerated, and the patient's response. So we would want to document the assessment date. I'm totally drawing a blank here. We would want to assess the procedure that we just did. We would want to also assess any type of data that we had assessed at the time of the procedure, and then also document how the patient tolerated the procedure. And then we would leave the room.